Well, here we are again talking about a preventable public health crisis that is disrupting schools, straining healthcare systems, and putting our most vulnerable at risk. And this one we thought we had solved decades ago, but we're here, and I get to introduce and we get to talk to two of the leading doctors in the world, one respiratory guy and one a pediatrician, about measles. Now, I'm Randi Weingarten, if you haven't recognized my voice yet. Measles was eliminated in the US in 2000. And yet today, we're seeing outbreaks in multiple states, and educators, school nurses, and healthcare workers are once again left to pick up the pieces. Why? There's a lot of reasons. One is misinformation and disinformation, and lots of false flags and concern about vaccines. Two, there are attacks on science. And three, there's a lack of public health leadership. And the federal government these days is choosing that kind of chaos over how to help communities grapple with what can be really scary, particularly for young kids, and how to deal with facts over fear. But let's be clear, measles is not just a school issue, it's a public health issue, it's a workforce issue, it's a community issue, it's all of our issues, whether we have young kids or not, or whether we're teaching young kids or not. So because it's all of our issues, and particularly since it's an issue that has really has reared its scary head in Texas in particular, that's why AFT is doing this webinar. You know, we have kind of stepped in to try to deal with and confront a lot of the chaos and a lot of the churn and a lot of the confusion that's being done by this very new administration, although it does feel like they've been here for quite a while now. It's only been 63 days. So, you know, we've taken lawsuits, we've done these kind of webinars, we've done a bunch of other kind of education, and we are, you know, fighting in the court of public opinion about not losing funding for Medicaid, or not losing Social Security, or not losing funding for education, basically higher education, or, you know, something that's near and dear to my heart, K-12. And, you know, just today we won another of the many lawsuits we've brought. This one, we won a preliminary injunction against the DOGE, which is Elon Musk's agency that's taken a chainsaw to government services. But as you remember, a couple of weeks ago, they just went into a bunch of agencies, IRS, Social Security, the Education Department, and just started rifling through people's personal information. So, you know, if you filed a student loan and had your tax return or other personal financial information, you didn't give the Department of Education that so that Elon Musk could use it or put it into an AI machine, or, you know, use it for later on. And so we sued the Department of Education and the Trump administration and Musk to say, no, you can't do that. That's not okay. And we just won that injunction today. So, but on this issue, on measles, we represent educators and healthcare professionals and public employees, so many who are on the very front end and the front lines of COVID, and are on the front lines of any public health crisis, including this one in terms of measles. And our members care for sick kids, they answer frantic parent emails, and they're really trying every single day to keep schools and hospitals safe and welcoming. So that's why we're here tonight, to kind of equip you with the facts, to push back against the fear mongering, and to help you protect your students, patients, communities, your own families, yourselves, just like we've done in a bunch of the other, town halls that we've been doing. So I do want to, before we dive in, I do want to just announce one very special new partnership. As many of you know, I am a lawyer. I am a high school social studies teacher. I've been an adjunct professor. I've been the leader of the AFT and before that the UFT for a long time. I know a lot. I started the safety and health program at the UFT, the New York City local, many, many, many years ago. But you noticed in that resume, I'm not a doctor. I'm not a nurse. And what we realized, particularly during COVID, is we really needed to have doctors that we could rely on. We have several members who are doctors now, but we really needed a doctor who we could rely on a lot. And we've done that with different doctors. But I get to announce that AFT is launching Vital Lessons Healthcare Chats with Dr. Vin Gupta. It's a year-long series on Share My Lesson, and it's designed to bring real-time, science-based health insights to our members and to our communities. And it's Vin Gupta, Dr. Vin Gupta, who is going to do this with us. And for any of you who haven't watched him, he's pretty prolific and really understandable. He's a leading public health expert. He's a pulmonologist, and he's a trusted voice in healthcare. I have to tell you, throughout lots of different healthcare issues, I will often text him and say, Doc, what do you think about this? What do you think about that? And he's joining all of us to help cut through the noise, to bring you the facts, and to explain it in ways that, at least, let me just say, understandable to me, because I don't understand doctors when I hear from them. And I understand Dr. Gupta, and my sister is a doctor, and my brother-in-law is a doctor. But he is so cool beans, and so glad that we have him doing this series. It's going to include webinars and blogs and resources tackling everything from infectious disease outbreaks to mental health to respiratory illnesses. And tonight's town hall is the first in that series, and I couldn't be more excited than to have Dr. Gupta with us. And Dr. Gupta brought a friend of his and a friend of all of ours with him tonight, Dr. Benjamin Hoffman, who's the former president of the American Academy of Pediatrics, and he's a national leader in child health advocacy. So here you have today people who really know what they're doing, and they want to talk to us and want to answer our questions. So, and it's about time, because the role of schools, look, schools are ground zero for public health crises. And if a student comes to school with measles, it's you, it's the teachers, it's school nurses, it's administrators who have to respond. And then it's the healthcare workers, many of whom are AFT members. We now represent nurses, respiratory therapists, physical therapists. We represent some doctors, hospitalists. We represent so many people who are healthcare workers now. And you're the ones who are treating these outbreaks. You're managing hospital surges, and you're battling misinformation. And then it's the public employees in social services and public health agencies and government offices who are coordinating responses. So that's why we're engaged in this conversation. And that's why we're leading it tonight. And look, would it be better if it was the Surgeon General of the Trump administration, as we've had Surgeon Generals before helping us? Yeah, of course it would be better. Of course it would be good if we had that. I'm not sure it would be better. would it be good if we had the head of the CDC? Would it be good if we had the head of HHS? Yes, of course it would. But they're not here. And frankly, they're not open to being here. So we have real experts who are going to help us tonight. And so it's my honor, my pleasure to actually introduce them, or Kelly Booz and Kelly Nedrow will be doing that. And they'll walk us through what's happening, how we got here, and most importantly, what we can do about it. And the questions that we'll tackle tonight are, look, why are measles cases rising? What's driving the outbreak? Obviously, vaccines. What role do vaccines play? And what public health measures need to be in place to stop the spread? How can schools, families, and healthcare workers respond? And what should public employees do? What should those who are in public health do? And the last two, what's the best way to push back against vaccine misinformation, particularly when you hear it coming from people who are now in government? And then we're going to do a little bit of self-care, which is the adults that are here. Do you need a booster shot? And who is most at risk? So let's get started. I'm really glad that we have this new Vital Lesson series. I want to thank publicly Vin and Ben. Thank you, Dr. Gupta. Thank you, Dr. Hoffman. And then thank all of you who are handling and navigating all of this. And that's not even, for many of you, your day job. So thank you, everybody. And turning it back to you, Kelly.
Well, and I think I've gotten Randi, both Kellys gave me the instruction to just dive right in here, since I know we have limited
fantastic.
time.
So I'm turning it back to you, Vin.
Well, Randi, it's hard. It's over.
To you.
Thank you, Randi. I don't mean this lightly when I say I think you could have any set of doctors in the country to partner with such a consequential organization like AFT. So I won't speak on behalf of Ben, who I'll be introducing shortly. But I can't tell you the privilege that it feels to have your trust, the team's trust, and for us to really kick this series off. And this is going to be a year-long series. We're going to talk about issues that matter for your health and safety, for your family's health and safety. And we're going to try to be as responsive as possible, and to do so in a way that's understandable and clear. That's our goal, is to use your time efficiently, but also to meet this moment that we're in, which is confusing and I know scary for a lot of people. So in that vein, the way we're going to try to do this, and we'd love your feedback, because I think one of the challenges sometimes is, when I do this for media, or when I know Dr. Hoffman does this in his role as recent past president of the AAP, we often don't have a lot of time to dive deep. And in this case, we have about 45 minutes of your time. And so we're going to try to be responsible stewards, but we'd love your feedback on what's working and maybe what we can change for future engagements. So for all of you out there, I'm going to kick this off. I will say now.
And Vin, let me just say to everybody who's listening, it's all of your feedback. It's not, I can text Vin anytime I want. It's your feedback. We really want to make this work for the people who are watching and listening. You are our most important audience, because we need to make sure this works for you.
Thank you, Randi. Yeah, I couldn't agree more. And to that end, I would say this is not intended to be death by PowerPoint or slides. I'm not trying to recreate day one med school here, just at a larger to a larger audience. We will not put you through that. But this is information that we're trying to create open source, completely free. And so if you find this resonant, and if you find this understandable, this is a slide deck that you'll have available to you. We'll make sure that you know where to access it, because if you want to take this forward and present it in your communities, or if you think somebody might find this useful, the whole goal here is to scale good information to push back against what we're seeing at the highest levels. So this is just an enabler for all of you, I hope. And if not, we will try to index and improve where we can. Here's what we're going to touch on. Measles, what is it? who is impacted, and then go into a little bit about symptoms and common misconceptions. And again, we have one of the nation's leading experts to help guide us through a Q&A. So if you have questions, Dr. Hoffman is on the ready. I'm going to be helping guide some of those questions with him. But please, part of this is just engagement and making sure that we get you answers to the questions that you might have. I'm going to advance forward here. So what is measles? And I think this is, and Dr. Hoffman, by the way, you don't have to wait till the very end. If there's things that please improve on or correct me on, or if you want to elaborate, just jump right in. But, what is measles? My wife's a pediatrician, and this is something that we sometimes chat about. What's an easy way to describe it that helps keep people's radars as vigilant as possible? That, for example, if they're seeing a rash on their child, how do you distinguish it from something that we often talk about that also causes a rash, that's also a virus, like chickenpox? And that's why I wanted to compare the two up front right now. Measles and chickenpox are caused by different viruses, but they both cause a rash. And often kids can be impacted, especially if they're not, in the case of measles at least, if they're not vaccinated. What we know about vaccines with kids is that you tend to get that vaccine regimen between, say, in the first year of life and then right around sort of pre-kindergarten. So anywhere from 4 to 6 years of age, that's the vaccine schedule. But measles can sometimes be confused with other viruses that cause rashes. But here's the key differentiator. And we're going to go through symptom profile in just a second. It is one, highly contagious, as is chickenpox, but it causes sort of a different sequence of symptoms. First, it can cause, and I'm just going to advance here because I think this explains it, and I'm going to come back. This is the symptom profile. So typically what we see is that it can take up to a week, even up to 2 weeks before somebody that gets exposed to measles starts to develop symptoms. And what we see in those initial symptoms is the typical flu-like presentation. They might have body aches, fevers, runny nose, watery eyes, and that's the first prodromal phase that we like to call it. That's where it's causing sickness. That's when it's potentially causing these sort of flu-like presentations. A few days after that sets in, and that's when we start to see really clear signs of, okay, here's something that's happening on this surface of the skin that also is a distinguisher from chickenpox. And these are tiny white spots in the mouth called Koplik spots. Doesn't really matter for the purpose of this conversation, but you'll start to see sort of white, bluish spots inside the mouth. And then a day or two after that, this is the so-called third phase of measles symptoms, you're going to start to see a rash that starts up at the forehead and then starts to make its way down to the trunk, to your abdomen, and then all the way down to your extremities. Usually when that third phase sets in, we expect in most cases that measles will run its course, hopefully, and that people will get better, kiddos will get better in most cases in about a week's time. Obviously, that's not always the case. I'm going to come back here a bit and just come back to who is impacted and where can things sort of go awry. So we know, number one, that the symptom profile here is there's different phases. It's different from, in this case, chickenpox. Let's go back to chickenpox here, where if you're a parent out there and you're wondering, well, gosh, how is the measles rash, once that phase sets in, different from the chickenpox rash? The chickenpox rash starts on the belly and on the back, and then it starts to sort of go up and down from there. Whereas the measles rash starts on the forehead and makes its way back down. So when you're thinking about, well, what is happening if you're noticing flu-like symptoms first and then the appearance of a rash, think about where it started and where it's going, and that can be a sign. In terms of who's impacted, really anybody. And that's where measles can be extremely, and that's exactly what we're seeing playing out. That's why we're having this conversation. Anybody can be impacted by measles, especially if they're not vaccinated. That's the key piece. But it's really what we're worried about here is those 5 years of age and under, unvaccinated. Those that are 60 years of age and older, especially with those with multiple chronic conditions. We're going to get into some of the nuance there. If that group is unvaccinated, or if they don't know their vaccine status, we're worried about them, just like the kiddos that might be unvaccinated. Anybody unvaccinated then is sort of that third group here, where they're still high risk, but not as high risk as, say, young kids and older individuals. Those that are immunocompromised. So if you're on a medication that's lowering your immune system response because you have rheumatoid arthritis, or we think of poorly controlled diabetes as an immunocompromising condition, that's also a situation where we'd say you're medically high risk, and we want to make sure that you're protected with the right regimen of vaccines and that you have clear evidence of antibodies in your blood. Talk more about that in a second. And then again, a group to be vigilant about is pregnant women. Pregnant women that are not vaccinated and that are exposed, they're a very vulnerable group. They can give, there's a higher risk of preterm birth in that cohort of individuals. And it's more than just getting vaccinated. If you know somebody, especially in places where there's the ongoing outbreak, like West Texas, New Mexico, frankly, it's in over 10 states across the country, they're pregnant, they've been exposed, and they're unvaccinated, that's a different conversation, where we'd actually consider giving them something called immunoglobulin, which is a form of an antibody that gives them basically passive immunity. We give them antibodies to fight off potential measles virus that might be in their body, so they don't have to wait for the vaccine and the 2 weeks it takes for it to really do its thing. So pregnant women, in particular, unvaccinated, exposed, we handle that use case, but that specific patient demographic slightly differently. I have this slide here just on the side to show you something real quick, which is to say, we're seeing that it's, again, the emphasis here that it's not just, measles is not just impacting young kids or those that are older, it's also impacting those, in the red shaded areas. We're seeing late teens, early 20s also be impacted, because now we're seeing a greater and greater prevalence of unvaccinated status in older teenagers and younger adults. And so to keep in mind here that everybody needs to be vigilant, not just those that are very young or those that are very old. Dr. Hoffman, I'm going to pause here to see if you have anything you want to add on anything that I've mentioned so far.
Yeah, thank you, Dr. Gupta. I want to add a couple of things. I want to say welcome to everybody, and thank you for this incredible opportunity. I'm really thrilled to be part of this. Thinking about the rash associated with measles and chickenpox, very different types of rash. Chickenpox is associated with what people often will call water blisters, and it's tremendously itchy. Whereas measles is more just red spots that you may be able to feel a little bit and is a little bit itchy. So, and I don't think it's your job as educators and medical professionals who are not pediatricians to worry about what type of rash it is. That's our job. If you have a question, that's when you give us a call. Relevant to that too, we've been incredibly effective since about 1995 in vaccinating kids against chickenpox, to the point that we don't see much chickenpox. So in 2025, if you have a kid with fever and rash, and especially some of the other associated findings, red eyes, and those sorts of things that we'll often see with measles, I would worry much more about measles than chickenpox.
Great. Thank you for that, Dr. Hoffman. I'm going to skip ahead, but I'm just going to keep coming to you just instead of waiting till the end, because I think will make more sense. And then we'll get to some other questions here. In terms of complications, this is something that, I will say as a pulmonologist, I felt has been a source of confusion for a lot of people, which is to say that I do think that there's been a lot of focus on the rash. You mentioned the differences with chickenpox, which I thought was very clear. Thank you. I do think in certain communities, there's a misunderstanding or perhaps lack of just awareness that the reason people end up in the hospital if they're unvaccinated, exposed to something like measles, is severe complications that have nothing to do with maybe the symptoms that they're seeing with their own eye, like the rash. It's actually severe measles causing things like pneumonia. And that is something that is unfortunately quite common, especially amongst those that are unprotected and tend to be in these high-risk groups that we mentioned, those that are younger, those that can be older, although we're seeing really anybody can be impacted. But these statistics here speak for themselves. About as many as 1 out of every 20 children with measles gets pneumonia. which is, as we're seeing tragically with the loss of the child in West Texas, it appears to be that was the cause, that measles-related pneumonia was the primary cause of death. There was also, from the Children's Hospital in Lubbock, reports from the spokesperson, the medical spokesperson, that there were other children requiring supplemental oxygen that were admitted. So this is a common manifestation of severe measles, which is by itself quite common if you're not vaccinated, which is to say pneumonia can be a serious problem. Encephalitis, swelling of the brain tissues, also something that can happen, less common than pneumonia like complications, but again, something to keep in mind. And then really just to emphasize again, pregnant, unvaccinated, exposed, speak to your obstetrician, gynecologist. Dr. Hoffman, your point that, these are, if you're seeing the rash or if you're seeing any of these signs, it's not for you to self-diagnose, but it's for you to have your radar up and to get help. If you know somebody unvaccinated, exposed to measles and pregnant, we need to get them help quickly, potentially, because we treat them slightly differently. Anything to add there, Dr. Hoffman?
No, I think we're great. Nicely done.
Great. I'm gonna just keep jumping right ahead, and because I know we should dive right in to questions. But current state of the Texas and New Mexico outbreak. Listen, many of you are reading the news headlines just as much as we are. About 400 cases have been announced as of today across the country. Almost all of them are in that sort of Western Panhandle part of Texas, parts of the eastern part of New Mexico. What we're seeing is that most of those cases, and you're seeing the statistics here, we're seeing about that 20%, 1 in 5 of cases are actually hospitalized. So that prior slide where I was showing you the statistics, they're bearing themselves out in reality. This is not just an abstract sort of medical discussion. What we're seeing in the evidence over the course and fullness of time is bearing itself out in reality. And also, by the way, 95% of people that are impacted are unvaccinated or do not know their vaccine status. So I think this is very clear demonstration of some of the evidence that we've long known to be true. This is the state of the state when it comes to where we're seeing measles cases across the country. And what I'll notice, and this gives me a point of some hope here, is that in the first half of February 2025, there was a nearly 50% increase in MMR vaccine uptake, the measles, mumps, rubella vaccine uptake in New Mexico, relative to that same period of time in 2024, February of 2024. And there was a belief, without drawing, I can't draw true causation here, that people are seeing what's happening, and some of the messaging that we're trying to put out there, that others are putting out there, is hopefully landing, that really the best way to protect yourself in the midst of this outbreak, if you are living in this part of the country or in anywhere where there's reported measles cases, again, we're shading the entire state. We don't have a county level view, but that it's important that the best thing you can do is to get vaccinated. And that vaccine, that one dose of the vaccine ends up, we see detectable antibodies, Dr. Hoffman, within just a few days of one dose. One dose, 93% effective. Everybody's citing these same numbers. 2 doses, 97% effective. Takes about 2 weeks for that to happen. I'm showing this because I think a lot of people have seen those data points, and many different types of messengers have been talking about the purpose of vaccination. But again, when we think about the ways in which this basic concept has been distorted, I think sometimes taking a broader aperture and saying what's actually happening, what's happened in our country since we've instituted measles vaccines of some variety in the late 1950s, early 1960s. These are the number of reported measles cases on the y-axis. This is time on the x-axis. And the lack of blue bars here, I think, says the picture that there has been a clear correlation between vaccine uptake. And, you need communities to hit about 95% vaccine uptake in their communities to really rid yourself of measles spread. I mean, so-called, we talked about herd immunity all the time during the pandemic. That's the concept that bears itself out. If you have high rates of vaccines, of uptake of the measles vaccines in these communities, you're going to see this trend line, as we showed here, from the 1960s on up to 2020, where there's a lot of progress. And so that's why we're so focused on this. I will say, just to talk about it real quick, the safety profile of the measles vaccine. This gives me a lot of, especially because what ends up happening is children that are unvaccinated, perhaps living in communities where we know misinformation is rampant right now. We're seeing it in pretty astonishing and shocking ways. I'm having a response to this. I know many of you on the call are in healthcare and are doing your work, and we really appreciate this. This is a full team effort, but there's a lot of confusion. And what I'm being told and what we're hearing, sadly, is that some people think that the vaccine itself is the reason why we're seeing this outbreak. I mean, that is being directly stated by some entities. And one, it's wrong. Two, there's no evidence at all that the vaccine is frankly just even unsafe. There's no evidence that it causes anything in the way of serious side effects. This is really what it is here. I've laid it out. But the common vaccines side effects from the measles vaccine are what you would think. Injection site soreness, muscle aches, mild fever, all self-limited, all resolved within 48 hours. Very rare and treatable, just to put it all out there. Sometimes there's a low platelet counts that can happen in rare cases. Anaphylaxis, a severe allergic reaction, extremely rare, treatable, but there have been some case reports of that, which, by the way, can happen in a variety of medical instances to medications, other vaccines, and we treat that, but again, extremely rare. In terms of delayed reactions to the vaccine, sometimes you won't see any of these sort of injection site soreness or mild fever at all. Most people don't experience any of this, frankly. But in some cases, we'll see that there's a rash that can appear about 6 to 12 days after the vaccine is administered. Again, self-limited, goes away. Lastly, I'll just say this, and I'm going to kick it to Dr. Hoffman for his thoughts. Autism and the measles vaccine, we're talking about it again. Our current HHS secretary and the organization that is doing some of the leading misinformation in the space, the Child Health Defense, are talking a lot about this. Our current health secretary talked about it a lot before he became the health secretary. And I think it's important to contend and wrestle with the data as transparently as possible. This has been studied endlessly. I actually put a table here from the seminal paper that was published in 1990 in The Lancet, showcasing that this has been studied repeatedly. Is there a link between the measles vaccine and somehow increased development of autism? The answer is no. It's been studied repeatedly over the last 30 years. There's no need to relitigate the science. It's wrong and it's false. And it's important, I think, that all of us are on the same page on that, because you're going to see a lot of that get recreated, it seems, over the next 4 years. But Dr. Hoffman, your thoughts just on safety profile, measles the vaccine effectiveness. And I'm going to sort of tee up a question that I know is coming. What are strategies that you've employed or you've seen employed effectively to contend with some of the misinformation tropes that are out there with respect to the safety of the vaccine?
Yeah, thank you for that, Vin. There's a lot to unpack there. I think if there's one thing that I would ask you to remember about the safety and efficacy of the measles vaccine, and any perceived rumored relationship to adverse events, including autism, that science is settled. It's not even, there's nothing even to litigate in there any longer. More research has been done on the measles vaccine than any other vaccine in history. And it is beyond, it's unimpeachable and beyond even a question at this point. So it is the same degree of misinformation as somebody who believed in a flat earth would be propagating. Anybody who is marketing misinformation around measles and autism, they believe they're trying to convince you the earth is flat. And that makes it challenging because to a large degree, that's an irrational belief. And you can't use rational arguments to convince somebody, to change somebody who has irrational beliefs. And that's part of what makes this so challenging. The measles vaccine itself, as Vin pointed out, it's exactly the same as your flu vaccine in terms of the things that we might see within 24 to 48 hours. And honestly, the only thing we know that the measles vaccine causes routinely is adults, because people survive childhood. The back in the 50s, the overwhelming burden of measles was borne by the young, and we saw 500 deaths a year in this country among kids, and we just don't see, like, I can tell you, I did my residency training between 1992 and 1996. We never, like, there was never no measles ever. Didn't happen. I currently live in Portland, Oregon, which is the community with the second highest rate of unimmunized kindergartners in the country. And we do see measles from time to time here, nothing like what they're seeing in West Texas and New Mexico. I think there's also a perception that, like chickenpox, measles is a normal childhood disease and it's a mild infection. I mean, even kids who have mild infections get really sick with measles. They are just miserable. And the fact that 20% of them get admitted is really, I mean, that's important. And I must add, when we're thinking about being admitted to the hospital, the bar to be admitted to the hospital in 2025 is much lower. I'm sorry, it's much higher than it was back in the 1950s, where people would be admitted for all sorts of things. We manage so many things at home now. To be admitted with pneumonia to a hospital, you have to be sick. And if 20% of the kids, who have been infected in West Texas are getting admitted, that's even scarier to me than that number would suggest.
It's such great. I think that's, sorry, go ahead, please.
Yeah. I think, there were arguments around the COVID pandemic that COVID didn't kill people, pneumonia killed people. And we have to recognize, and I would hope that the majority of people who are on this call today recognize that it's a consequence. Pneumonia is a secondary infection. The virus, whether it's COVID or measles, it knocks your immune system for a loop, and it makes it hard for your immune system to do the job that it's supposed to do to protect you from everything else. And that sets you up for all of these secondary things, the encephalitis, the pneumonia, there are a bunch of horrible other things that can happen. So that's I think that's another piece of misinformation. I think that the fear around the side effects and autism, which has been propagated solely through lies and fear mongering, the minimization of the severity of measles as a even an quote unquote uncomplicated case, and then the conflation of or that the attempt to sort of decouple measles from the horrible secondary outcomes. What we know about talking to families is that, first of all, I want to acknowledge that while vocal and loud and very visible, the anti-vaccination community is relatively small. The overwhelming number of parents and caregivers support vaccines, right? Vin talked about with measles, the threshold is 95% community vaccination. So if we're talking, if you get down into the low 90s, you're putting, people are at risk for a measles epidemic. You're still 90+% people are vaccinating. Right. And so we need to acknowledge that vaccination is still accepted. It's still the norm, although we now have people in power who may choose not to believe that. We know that the American Academy of Pediatrics has done some work with a nonprofit called the Frameworks Institute around immunization, vaccine communication stuff. We know that what works is not throwing data at people, not trying to make them feel bad, not trying to put fear into them, but talking about some of the positive benefits, including the fact that every one of us can agree, whether you're, regardless of your political bent and where you live, that every child in our community deserves the opportunity to grow and thrive in a safe and healthy place. Everybody can get on board for that. We know that vaccines are one crucial tool that help prevent diseases that will impede the ability of a child to live, grow, develop, and attend school. We know that the immune system is something that needs to be taught. And in the same way that we teach kids to read, vaccines teach the immune system how to respond to threats. And instead of having to respond to those threats, instead of having to fight a lion in the jungle, if you know how to avoid the lion, you're more likely to survive. And vaccines prime the immune system, teach it to recognize potential threats, so it will be more efficient and more effective in minimizing those threats. One metaphor that I think that I've had tremendous success with is the connection between vaccines and the operating system on your phone. Why do you update when you get a push from your carrier that your phone needs an update?
Mm-hmm.
What is that update designed to do? And why do we follow those instructions? Right? Because things change over time. Threats emerge that we may not have anticipated in the tech world. And those updates teach the phone how to avoid those threats. That's exactly what vaccines do.
I love that. Thank you, Ben. And I like the metaphor a lot, because I think that's we need different ways to talk about it, and especially reaching younger generations. I like the tech analogy. I want to move us along a little bit, and since I know some questions are popping in our chat, thank you for everybody. These are only as useful as all of you feel engaged in the conversation. So I'm going to bring in some of the questions up front now. I do want to just close on our sort of discussion part, just to say real quick, correcting the record, which I think Dr. Hoffman already did on a variety of different things. I want to emphasize 2 points here real quick. In the next 4 years, sadly, we're going to be listening to folks that, unlike Dr. Hoffman, myself, and our colleagues, aren't humbled by bedside care. And, we all know the personalities that are now being at these podiums. And I think a common trait is that most of them, not everybody, but most of them, aren't humbled by the experience of what it's like to actually still care for patients, if they've cared for patients whatsoever. And I say that because it causes me a lot of anger when I have to hear and try to debunk with Dr. Hoffman and others silliness and this utter nonsense that we know that there's no evidence to back it up. And I suspect that if they were humbled by the patient journey in a hospital setting, me in an ICU, Dr. Hoffman sort of across the spectrum in pediatrics, they might be less likely to talk about these things. But for example, vitamin A and measles has gotten a lot of attention. And it's been tragic to see what's been happening, but people are not presenting to care in places like New Mexico and West Texas until it's very late, hence children requiring supplemental oxygen because they're self-medicating with cod liver oil, which has high concentration of vitamin A. Let's be clear. Let's acknowledge what is true, which is to say that in parts of the world where vitamin A we know is deficient, such as in sub-Saharan Africa or parts of Asia, if a child has measles, irrespective of their vaccine status, they will get vitamin A supplementation. Turns out, Dr. Hoffman, as you know well, the American Academy of Pediatrics, regardless of the child's vaccine status, if they have a case of measles, they will also get vitamin A supplementation in a clinical setting. So it's a moot point. But this is not something that addresses an underlying risk factor for American children, because this is not where vitamin A deficiency is common. Your thoughts?
Yeah, it is no substitute for vaccination. I mean, there is one way and one way only to prevent measles, and that's through vaccination.
Okay, thank you. Real quick, and then I'm going to kick it over. I think Randy might be coming back on, maybe give voice to some of the questions. Cod liver oil, again, you're going to hear a lot about it.
Exactly.
It's a supplement that is not regulated or been studied. It has high amounts of vitamin A. Vitamin A has its purpose. We're not saying it doesn't have its purpose. It is not a treatment. Lastly, I'll just say, because we had to respond to a lot of this last week, do not expose yourself. For those that are going out and educating your communities, natural immunity to measles does not protect against cancer or heart disease, unlike comments that are coming from the very highest levels. There's no evidence for that. What there is evidence for is what we mentioned with vitamin A in the setting of being an adjunct to treating a child with pneumonia. And it's something that's utilized across the board. So there's some context clarifying there. there is no evidence that natural immunity is something you want to risk, or nor does it portend any health benefits. So let's be clear on that. But Randy, I'm going to kick it over to you because I know we have some questions popping in.
So thank you, both of you. Thank you so much for this. The question that is in the chat a lot is, I think I got my vaccine many, many years ago, you know, in the 30s, in the 40s, or maybe in the 50s, maybe in the 60s, maybe in the 70s. I clearly have no record of it anymore. I can't even find it, you know, what the record would be. What do I do right now? So you had a lot of questions from adults who are asking some version of that question.
Ben, maybe I can start, and then
Sure.
if you can improve on it.
Yeah.
So I think this is, for everybody watching right now, here's the complexity is, as you see on this figure on the left, that is about as clear as it gets, but it's still pretty, and it's, I think, needlessly complicated. And so here it is. If you're before 1957, by definition, that means you're, if I'm doing my spot math right, that means you're sort of, 68 on up potentially, or older. And so if you're born 57, you're 68 on up. My advice would be simply, if you don't know for a fact that you had measles, and most people don't, I've had this conversation now with so many people. Well, doc, I don't remember if I had measles. The thought here is that, well, there's so much measles everywhere that you were probably exposed and have natural immunity. But the truth is, it's easy enough to do one of two things. One, just to get a booster shot, which I think is completely fine. It's completely safe. There's no concerns on it. Or if you want to be if you want to have a little bit more data, it's very easy on your next cholesterol check, which is something that should be a part of an annual well visit every few years at least, to tack it on, to do a measles titer assessment. And to do that, I would recommend doing that soon, because this is going to be a bad year of measles, where I think you can't guarantee, especially if you're traveling for spring break or you're just living your life, you might get exposed. You have no idea. So I'd recommend either just getting it if you want for just frictionless experience, or if you want more data, you should be getting regular blood draws, every few years at least, for a lipid panel check if you're in that age group. Tack on a measles titer and maybe do it sooner rather than later. So it's two birds, one stone. But either one works, in my opinion. And I think we've been too much confusion here. Between 57 and 89, I fall into that age group. The question
too.
is, just we're all in that age group. Also, a lot of confusion. If you do not have a documentation of 2 measles shots, just get the measles, get an additional shot. I have documentation of 2. I feel comfortable with that. My titers have also been checked for a variety of reasons. I've been in the military reserves, so we've had to do that. If you don't have documentation of 2 shots, you should get another shot, plain and simple. After 1989, because there's been more sort of standardization in what types of measles vaccines the CDC has been recommending, and just documentation standardization, usually there's no issues here. One, most people know their vaccine status, and 2, it's been with sort of the same approach on vaccines that we now currently employ. So that's why there's sort of different recommendations based on age group. It's a lot confusing. If you're at all unclear and you don't want to bother with a blood puncture or blood sample, even though I would argue everybody should be getting a lipid panel test, once at least every few years, just go ahead and make an appointment for a measles booster, and you should be able to get it. Supply issues have not been a problem thus far, at least. And so that's my answer. But I don't know, Dr. Hoffman, if you have any disagreements or improvements on that.
No, and you're talking about the other end of the spectrum from my expertise.
That's right.
So I would trust you on that. I mean, and my go-to is always talk to your doctor.
Absolutely.
If you that's what primary care relationships are all about. But I like the way that you're approaching it. I think your approach makes complete sense and aligns with everything that I've heard.
That is what, that's what most of the questions on here have basically been about. It's what do we do given everything else given our age, what do we do? And I think what you just said, Dr. Hoffman, about going to your own doctor is really, really, really important. There's also people who have said, I had measles as a kid. Am I okay? We have a bunch of those kind of questions too.
Yeah, measles is sort of like chickenpox in that way, that if you know 100% for sure that that's what you had, and you survived it, then you probably don't need vaccination. That we do the same thing with the chickenpox vaccine. I wouldn't. If there's any question, I would follow Dr. Gupta's advice and either get titers or just get the vaccine. If you know for sure, then you should be okay. And I've seen some questions too about, if you got it at a year of age and then at 4 to 6, as is recommended, do you have to worry about it again? And the honest answer is no. There are some questions in there about immunologic amnesia and things changing over time.
Right.
There are some people who have you can get differing level of immune response to a particular vaccine. If you're 100% certain that you've been vaccinated and you get titers and you don't have any, and there's no evidence of anything, then you should talk to your physician about that. If you know for sure, like I do, that I got 2 vaccines, there should be nothing to worry about. If you got it at a year and then 4 to 6, you should be good for the rest of your life, barring other changes in your immunity. Sorry, Vin, go ahead.
No, and actually, Rand, if I can, I was just going to add on to that I know a question that seems like as popping as well, and that I've gotten is, do antibodies wane over time? So if you got either exposed and natural immunity, or if you've gotten the vaccine at some point, do you need to check it even if you have proof of 2 shots? And my answer to that is, if you do not have an underlying medical condition, you have proof of 2 shots, you are good. Mm-hmm. If you have an underlying medical condition that is immunocompromising, and we talked so much about this, Randy, during the pandemic, Ben, you and I as well, that's something like being on prednisone, or if you're on dialysis, and it's a pretty wide spectrum of what being immunocompromised could mean. But if you're on a medication that impairs or lowers your immune system response because you have, say, a rheumatologic disease, or if you're poorly controlled diabetic or on dialysis, those are, and this is where the emphasis to speak to your medical provider to really understand that, if you have any questions, is important. But that's also where I'd say that's the exception. If you have documented 2 proof, but you have that type of condition or something on that spectrum, you're somebody I'd say, on balance, sure, let's get your titers checked just to make sure.
And we should say to everybody who's listening, look, I'm clearly not your doctor and can't dispense any medical knowledge, but neither Dr. Gupta nor Dr. Hoffman are anybody's doctors here, and so some of the issues we can't really answer, and we can't really ask them to answer in terms of this, particularly in terms of certain other issues that somebody may have. So when somebody says you're going to have to see your physician, yes, I know there's huge issues with the healthcare system right now and whether or not people have physicians. And we're fighting that in all sorts of different ways, including, having wraparound services around schools, that, making sure that people fighting for the ACA to continue, fighting for Medicaid to continue, fighting for Medicare to be intact and not undermined by an Advantage plan. So we're, and in collective bargaining, we're fighting for people to have health care. So I don't mean to not answer those questions. It's just, it's not fair for us to press these 2 amazing doctors to answer a question where they don't know, and they're not going to ask you in the middle of this forum, a lot of personal questions. So that's why, I just don't want people to feel like I'm ignoring them. Someone asked, will there be a recording of the talk because was only able to join very late? I think Kelly Booz will say yes. Of course, there's going to be a recording of the talk. And this is part of the series that we're doing with Dr. Gupta. Every month, we're going to do, another, kind of, we'll probably do it more than every month, given everything that's going on. But these vital lessons, these healthcare chats, we're going to do these kind of things. There's one other question from a school nurse. I think I just lost it, about what happens if somebody in the school has measles. Here it is. If we have a positive case, do you suggest excluding all dissenters in the school or close contacts in the classroom?
Can I answer that?
Yes.
Absolutely.
Thank you.
So, measles, at least today, as it has been during the 30 years I've been a physician, is a reportable disease, meaning the state needs to be notified, which means that your state health department, your county health department needs to be aware, and then you follow their guidance. There is well-articulated guidance from the American Academy of Pediatrics, from the Centers for Disease Control, about how you address a case or a number of cases. And so a school health nurse, and thank you for doing that work, love it, you shouldn't have to be burdened with making any decisions other than making sure that your health department is aware and that school administration is aware. One of the things we touched on but didn't really go into is just how unbelievably contagious measles is. To give you an example, if somebody went into your school gym with measles and coughed and then walked out, and then 10 kids who were unimmunized walked into the gym 2 hours later, the likelihood is that 9 of those kids would get measles. One cough in a gym 2 hours ago, 90%. So you got to take it seriously.
And thank you, Ben. And Randy, I just wanted to layer on something slightly related, which is I know it looks like there's a lot of questions about titers and what is a titer, and just, how do we think about that? If for those that are wondering if they want to get their antibody status checked, it would look different based on, perhaps what you're seeing, but usually what it would be is a conversation with their medical provider to say, I think I got the vaccine when I was younger, or maybe you were exposed if you're in that sort of septuagenarian cohort, and you want to ask for your measles antibody titers, which are effectively just the level of antibodies in your blood. And if they're past a certain point, we sort of measure it on the concentration of antibodies to the measles virus in your blood. If they're past a certain point, then we can say, yes, indeed, you have enough antibody that is protected, versus if, for whatever reason, you might have below the level of detection or not enough, we would also surface that. And that's where the test can provide you guidance on whether you should get that additional shot. And so that's what the titer refers to.
So what would be good in the questioning box as well is that if people have other topics because I saw a topic about the mumps, we talked a little bit about chickenpox, but if there are other topics that people want us to talk about, even right now, put them into the Q&A. But what we're going to do over the course of the next year is topics that we know from our staff, from the emails I get from people, and you all know my email. It's rweingarten@aft.org or the aft.org website. We'll just keep on doing these kind of really wellness and public health questions and answers, because we know that you're not getting it anywhere else. So I want to just turn it over, I think, to Kelly Booz, and I want to say to Dr. Gupta and Dr. Hoffman, thank you so much for this remarkably informative I would say, Dr. Hoffman, it was pretty scary what you just said about the gym and the contagion and how contagious this is. But, you know, better safe than sorry. And vaccines, vaccines, vaccines. And you saw Dr. Gupta's chart about, you know, how the vaccines changed over time and, you know, getting a booster if you don't know. And you saw that chart. But talk to your doctor. Do things quickly. Thank you, Dr. Gupta. Thank you, Dr. Hoffman, so much for this incredible hour of learning about what to do about measles. And I'm going to turn it back over to Kelly Booth.
Yeah, thank you, Dr. Gupta. Thank you, Randy. Thank you, Dr. Hoffman. Hoping my audio, I've been having technical issues today, so hopefully my audio is working right now. I'm just on my phone at this point. But I want to flag to please join the Vital Lessons community on Share My Lesson, where you can post questions that you have on different health-related topics. We just launched it today. So please add that in there. Also, feel free to rate and review this webinar, which should be in the chat box. I'll post that here right now. And then I also want to mention that Randy will be back with us. We are kicking off our Share My Lesson annual virtual conference tomorrow. Wednesday and Thursday, we have 30 plus webinars covering a variety of topics, and Randy is our keynote speaker on Wednesday to talk about the state of public education. Not that that's going to be, there's nothing going on in public education these days, right, Randy? Kidding. We've got a lot to cover, a lot of very important topics to cover. So appreciate that. So please join us. I'm also. Sorry, go ahead, Randy.
I said, who knew you were such a comedian?
I try. But if you need a lighthearted keynote, I will be kicking off our keynotes tomorrow night, where we talk about AI and education and the AI Educator series. So hopefully you can join us there. We're also doing a giveaway. I feel like I have to highlight with our two doctors on here that we're doing a giveaway, win one of 3 Aura health rings and a 1-year membership as part of the conference. So I'll put a link into that as well. And again, just want to say thank you. This is the beginning of a beautiful relationship, and we're excited to work with you, Dr. Gupta and Dr. Hoffman. I hope you come back and join us in a future webinar as well. So thanks to everyone. All right. Have a good night.
Have a good night, everybody. Thank you.